Yeah, it's Coronation Park, I think.
16 years old, a son, an older brother, and loyal friend. Finlay van der Werken's life is now a collection of memories closely guarded by his parents.
I still hear his laughter. We do what we can to keep his memory alive, but we miss him so much.
In early February of 2024, a migraine kept Finlay home from school, but his condition got worse.
He was crying out in pain a lot. He didn't know what was going on, but he knew it was not normal. So I drove as fast as I could.
Hazel took her son to Oakville Trafalgar Memorial Hospital just outside of Toronto. She says he would not see a doctor for hours despite telling the nurses Finlay was not doing well.
When I went up at 3 a.m, they said, well, we only have one doctor. But there's another one coming in at 4. I don't know where that one doctor was.
Finlay was triaged at almost exactly 10 o'clock, and he wasn't actually seen by a physician until 6:22 in the morning.
According to the statement of claim about what happened that morning, the doctor said Finlay was experiencing sepsis pneumonia with hypoxia, and he was at high risk for acute deterioration. His oxygen levels, which hospital records show had been dropping throughout the night, were a concern.
I remember just saying to Finlay, Finlay, we got to get, we're looking at this screen that's got his oxygen saturation. I'm like, we have to get it up. And his breathing was so shallow by this point. And he said, I can't do deep breaths. It hurts too much.
Wow.
I said, you got to try.
Finlay eventually needed to be intubated and also suffered a cardiac arrest. Finlay was taken to Sick Kids Hospital in Toronto, but it was too late, as he was then in hypotensive shock.
We had to make the decision to take Finlay off life support.
Or risk that the situation would escalate even more and he would wake up and die in a lot of pain.
After Finlay died, hospital staff did meet with the family to review what happened. In a written statement, officials said, like many hospitals, we are seeing more patients presenting with increasingly complex health conditions and comorbidities. This places significant demand on our emergency departments, patient flow, bed availability, and the patient experience. The family has since launched a lawsuit alleging, in part, the healthcare team failed to monitor Finlay, have appropriate protocols in place for his treatment, or inform the family of the true nature of his condition.
The experts are quite clear and unequivocal that this was a treatable condition, and had he been treated promptly, there is no doubt in my mind that he would still be here today. He was triaged as a second highest level in triage, and the guidelines say that 95% of the time, they should be seen within 15 minutes.
The hospital says they are making changes to track data more closely, refining their on-call coverage criteria protocols, and implementing other tools and working groups to improve patient flow and communication. But the family wants more awareness so something like this never happens again.
But we feel that we have been let down and we cannot trust the medical system as it is right now.
Catherine Ward, Global News.
So this is the story. But it gets worse. So I've done quite a few hours of research over this morning, because this is not an isolated incident. Like, this is brutal. I can, as a brand new father, I cannot begin to fucking imagine what that family is going through. But I started looking this morning, and I literally went down the rabbit hole of looking at what's happening behind closed doors that people are not talking about. And I kind of did a carousel for my Instagram with all the information, and then I'll explain what she meant, what the lawyer was talking about when it comes to how triage works. And guys, just so you know, I'm trying to find somebody that is part of the system. I found someone. I'm going to try to call them today or tomorrow to see if they can come on the show. He's very outspoken. He's a doctor. He's very outspoken about this to explain what I found.
So you should be.
100%. 100%. It's just, I went through it as just a guy that does a shit ton of research as a independent media, but I would love to have an expert, just like we did with the food professor to come up and say, are we wrong? Are we right? What are we missing? What's going on? But here is something I did this morning, and I just want to share this because of the statistics. So it's estimated right now by a 2024 report by the Canadian Journal of Emergency Medicine. It's estimated that between 8 and 15,000 Canadians die yearly in overcrowded emergency rooms. So basically, the story is
this just in Canada?
Yeah, this is just in Canada, but that's nothing, bro. This is just, give it a second. This is just the tip of the iceberg. So the situation that you just heard, this is 8 to 15,000 a year because of overcrowded emergency rooms. That's one. Second, 15,474 Canadians died in 2023-2024 alone while waiting for surgeries, scan. But it's estimated by secondstreet.org on an article that they published on January 15, 2025, that it's possibly double. So it's somewhere between 28,000 to 31,000. And that you add to the number that I just said. So 8 to 15,000 Canadians die estimatedly per year, because that number is not published. There's a company out there that went, and there's an organization out there, that went out there and looked at the numbers individually. That's how they know. That's why they say it's worse, because what they found is actually worse by asking the provincial governments of each province in Canada and tabulating. But 8 to 15,000 a year.
I thought there was no way.
Oh, bro.
I thought there was no way when I looked at those numbers.
It gets worse, man. It gets worse. So 8 to 15,000 die waiting for an ER. Then you have something like at least 15,000 patients that die. That was just in 2024, waiting for a surgery or a scan. So that means that they've already been to the emergency and they're waiting to the next step, or this is normally when it comes to general practitioner. You saw your general practitioner, it's like, you need to CT scan, you need to go this surgery. While they're waiting, they die. So they're saying the low number is 15,474, but it's estimated that it's closer between 28,000 to 31,000. Now, they're saying they have the numbers to prove that since 2018, 2019, 76,596 Canadians have died on the waiting list for a surgery or a scan. So that number there, you need to add it 8 to 15,000 every year on top of that number. So you're starting to look at some very fucked up numbers. And these are the number provided by Fraser Institute. I've talked about those numbers before, but right now, as per 2023, 2022, or no, that was 2023. Actually, hold on. Fraser Institute, December 12th, 2024, Waiting Your Turn is the name of the report that you can find. But they estimate that it takes 30 weeks to see a specialist after seeing a general practitioner, up 322% since 1993. It used to be 9.3 weeks in 1993, went up in 2019 to 20.9, and now it's at 30. Right now, I looked at the latest numbers because I've published those numbers before, but the numbers that I had published a couple of months ago were 9,200. But it turns out that as per the estimation based on the Canadian Institute for Health Information, this year our free healthcare system will cost $381 billion, which is about $9,500 per capita. So per person in Canada that is taking advantage of our healthcare, $9,500 to supply to our free healthcare. And just to put it into perspective, we are spending 30% of our income tax, the equivalent of 30% of all the money that is captured by the federal government on your income tax is spent on our healthcare. Yet we have thousands of Canadians dying in the ER, and we have thousands of Canadians dying on waiting lists. And think about it, those numbers are only going to get worse because our population is aging. And what are we doing? We keep on bringing immigrants, foreigners in on a system that's already fucking broken. So, man, if you thought those numbers, I did not realize those fucking numbers. This is just me this morning. I was up at 3 and I started doing some research and I'm like, what the fuck is going on here?
Yeah, you texted me at like 4 a.m.
Yeah, and I had been up for 1 o'clock. The baby was fed, I was shaved, I was showered, I was good to go. So all to say that those numbers, I tabulated myself. I have all the sources. I named my sources in what I provide. I still have them. So those numbers are real and they're the lower end of estimates. I never use the higher end. I always use the lower end, but those numbers are fucked. We're talking about 30,000 people a year, 45,000 people a year die because of our, the joke to say that have you considered MAID? It's not a fucking joke. It literally is not a fucking joke. And for the people out there that don't know this, it takes less time to get approved for MAID than it does to get a government-provided psychologist. Just saying. So
when I saw those numbers, I thought that's got to be wrong. But
you should know better.
I looked. I looked it up, and that is correct. And that's fucking insane. It's what we were talking about yesterday. Broadly speaking, I do support a universal healthcare system, but that's on the assumption that it fucking works. There's a social contract that Canadians have with their government. It is, yes, okay, we understand we are taxed to shit, but we expect something in return. Yes, you can tax the shit out of us, but we expect quality healthcare. We expect good infrastructure. We expect good roads, good education system, and we're not getting any of that. So, like I said, I am broadly speaking in support of universal healthcare, but again, that's assuming that it works. And stuff like this makes you wonder, is this even working? Now, I looked up something else as you were talking. I was like, just out of curiosity, because these numbers are going to blow your mind too. How many people die in American ERs? And the numbers aren't quite as strong, but I was able to find a study in a 4-year period from 2016 to 2019. There were 34,000 deaths in 4 years. So that's what? Divide that by 4. That's like 7,000 a year. So they have less than half of the deaths in our ER overall, despite having 10 times the fucking population. As Dr. Charlebois was just saying, there's this idea that Canadians are morally superior to Americans. And I think the healthcare system is a big part of that. We have this idea that we do it right and they do it wrong. And you look at those numbers and it certainly makes you wonder if fucking 8,000 people a year are dying in the ER in a country of 350 million. And we have up to 15,000 a year dying in a country of 40 million. That's a pretty strong data point that maybe we're the ones that are wrong.
So here are some things that are worth mentioning, because if you remember, the lawyer in the video that I showed was talking about treating time and triage times. So there's 5 levels. So here's what's supposed to happen in Canada. So in Canada, you are supposed to see a nurse, a triage nurse, somebody that's, when you show up, they ask you some questions and they're going to figure out your level of emergency. There's 5 levels of emergency that I'll show you in a second. But normally you want it to be, it says that it's between 10 to 15 minutes. So the median is about 12 minutes that it takes throughout Canada in order to see a practitioner. To see just the triage, to receive your level. There's 5 levels, right? There's level 1, which is resuscitation. It's, imagine somebody that's been shot, somebody that's unconscious, somebody that you literally need to help right now or else they're going to die. But in the video, they talked about level 2, which is called emergent. But it is somebody that, if not treated immediately, could die. They're not They haven't been shot. They're not in their last breath, but they're fucking getting there. Then you have level 3, which is urgent. They call them serious but stable conditions. Then you have level 4, that is condition that needs medical attention but are not time critical. Literally, that's probably you broke an arm type of deal. And then you have the non-urgent, which I'd be very curious to see in a
sprain ankle.
No, but in a system where it's free, that people don't have to pay, there's a lot of hypochondriacs out there.
Yes.
So that's another problem that we have.
Yeah, that's a good point.
That definitely needs to be addressed. But for the sake of this conversation, the lawyer said that he was, my apologies, assigned level 2, which means that he needs to see a nurse he needs to see a doctor within 15 minutes. 15 minutes. And she mentioned the 95%. Basically what she said for CTAS level 2, which is what he was, the CTAS guideline recommends a physician assessment within 15 minutes within 95% of the time. But real world data suggests a median wait time of 1 to 2 hours for 50% of the patients, with 90% of the patients being seen within 3 to 4 hours in most of the cases. So this is what you're seeing right now. So you have a young man that should have been in front of a doctor, not in front of a triage nurse, in front of a doctor within 15 minutes, ended up waiting hours to see a doctor. And by the time he saw a doctor, he was sent to the child hospital, and he was put on life support, and they pulled the plug. So basically, our system dropped him. He is dead 100% because of our system. But keep in mind, guys, it is estimated that between 8 to 15,000 people every year die from waiting in a fucking ER. 15,000 Canadians. That is fucking insane. That's insane.
And you don't hear anything about it. You don't hear anything about it.
And this is and the reason I wanted to talk about it is because this is a non-partisan issue. I don't hear Poliev calling this shit out. Neither am I seeing Carney speaking about this shit. No party is touching that one with a fucking 10-foot pole. Yet 15,000 people, 8 to 15 die in the ER, and 15,000 to 28,000 die every year on fucking waiting lists. We're starting to talk about 15 to 40-ish thousand people every year. And that doesn't count malpractice. That doesn't count everything else that could happen while you're at the hospital. No. This is just waiting. You are dying because you waited too long.
So there's as we were watching that story, there's a couple things that jumped out to me. One was, when the mother was discussing, they went in, and what did they say? We only have one doctor in, but another will be on at 6:30. Go get that fucking doctor. Where was he? Was he in a smoke break or something? He's there. My son's dying. The other one was, and you kind of hinted at it there a second ago. They moved him to the sick kids in Toronto, and then the parents go in there and they decide to pull him off the plug. But it makes you wonder. They even said he might wake up and be in extreme pain, and it makes you wonder if wasn't said to them to almost manipulate them into getting off the plug, because obviously in a socialized medicine system, someone on life support for a long period of time is extremely expensive, and maybe the doctors are pushing people, and we need to know if that's what's going on. Is that true, what they're telling the doctors? And the third thing, and this is kind of what Trevor Benson said when he says, how many from the shot? Do you remember when the hospital administrator said something like all hospitals, we are seeing an increase in complex medical conditions and blah, blah, blah. And I was thinking, is there any curiosity to why that is? Why, when did this start? Did this start in 2020, 2021? Why is there an increase in complex medical conditions? Is anybody concerned about this whatsoever? Or are you just accepting it as, it is what it is. What can we do? Makes you wonder.
Do you want to get your mind blown?
Yep.
Let me blow your mind right here. I'm just writing this because I did not realize this as we were talking. I'm like, how the fuck did I not talk about this? Here are the main causes of death in Canada. Those are the numbers published by Statistic Canada in 2023. Around 85,000 people die of cancer, 57,000 die of the heart disease. If we look at the low numbers, 8,000 plus 15,000 that I showed, you're talking 23,000. Waiting to get healthcare is the third largest reason for people dying in Canada. The third leading cause of death in Canada is waiting on our fucking broken system. But if you look at the upper numbers, you're talking 15,000 plus a 28 to 31. It is almost tied with the second.
And the numbers, those numbers are hidden within these numbers because all those people are in this list right here, but they're not listed as waiting for healthcare. They're listed as what they died for, regardless of if it's preventable or not. Yeah, I mean,
imagine that those people are all from. I'm ready to bet that all of those people are part of this right here. They're all going to be part of the top 5 for sure. They're all going to be part because they're emergencies and they ended up dying because they didn't get care soon enough. So that means they're either cancer, heart disease. Obviously, they're not accidents, but they are disease of some type. So you know that they're top 5 in there. So chances are, if you remove those people from the category that they are identified at, and you put them in the real category that they should be in, it will lower those numbers. And there's a category that's going to pop up with 23 to 45,000 people in it. So this is the reality in fucking Canada.
Well,
the third reason of death is waiting on a system that is fucking broken. And our solution is to bring in more people to take advantage of that system.
I mean, as you say,
fucking brilliant shit.
This should not be a partisan issue. If you're on the right, obviously you're gonna be concerned with this because this is evidence that the system is broken. But even if you're on the left and you are supportive of universal healthcare, you should be very concerned about this and you should be speaking up because this just makes the case that maybe we don't have it right. Maybe this is not the way to go. At least be speaking up, and if only to say we need to do better, we need to fix something here, because whatever it is, this when you look at those numbers, it's hard to make the case that the system is working.
It's insane, isn't it?
Yeah.
I did not know those numbers until this morning. Now it's something that I will drill in, day out. Every few days I'm going to be talking about this because this is insane to me. This is absolutely fucking insane to me. That
is fucking wild. Yeah. I thought there was no way those numbers are real, but they are.
I'm gonna find, like I said, I'm gonna find somebody to come on the show to just address this and tell us if we're on crack, what the fuck's going on here, why is this happening, what's the solution, and is there a solution? Is our social service, that is our healthcare service, even possible anymore?
Is it fixable? Yeah.
Yeah, because I don't think it is. Personally, I don't think it's a problem because it's been a problem for decades. It's just that it's never addressed. It's never a main point. I don't remember them talking about this at the debate between the leaders, just saying that, yet, what are the major problems in Canada right now? Immigration, economy, healthcare, we have the mentally ill running the asylum and the trans agenda. Yep. And then what's the fifth? Our housing crisis. That right there. Those are probably our top 5 problems right now. And that one's never addressed. We don't talk about it. We shove it under the carpet and we just completely avoid it. But it is insane. Absolutely insane. And I don't know what the solution is. I don't claim to know what the solution is. I just know there's a fucking problem that needs to be addressed.
Yeah, I agree. That'd be good. I'd like to talk to someone from inside the system and get their take on it.
Yeah, I'll find someone.
Because I mean, neither you nor me are really qualified to make those calls. But certainly, I'd like to hear from someone inside the system, like how do you think you could fix this?
The thing is my job is not necessarily to find a solution. My job is to identify a problem, find experts, and then have them tell us what the solution is, because I just want to open that conversation. I just want to be able to have, just like Sylvain today, I want to be able to have people show up and just say, are we crazy? Are we alarmists? Is there not a problem and we're just inventing one? Or is there really a problem? Do people understand that there's a problem? If so, why the fuck is it not fixed, and how do we fix it?
Yeah, I mean, that's I think that's one of the great things about the show is that we get those people on here,
100%.
that who are experts and who can tell us, because neither of us are. We have our opinions, but obviously we defer to the experts on that one, as long as they're not compromised experts.
I have a very informed opinion, but I'm not there to find the solution because I'm not the expert. I'm just very good at doing research. That's what it comes down to.